Hi, I'm Dr. Sian Williams, speaking on behalf of my co-authors on our work published in the Journal of Clinical Medicine. This was a mixed method study that captured the experience of diagnosis and early management of cerebral palsy for families in Aotearoa, New Zealand. Listening to the family experience is integral to identifying areas of strength and for improvement in health service delivery. Families of children with a diagnosis of cerebral palsy were invited to complete a purpose-developed electronic survey that included questions around the timing of their child's diagnosis, their satisfaction, and their experiences, and also allowing families to expand on their experiences through free written text. Of 57 families responding, 32 reported that general paediatricians were the provider of the diagnosis. Perceived delays in the receipt of diagnosis of cerebral palsy appeared common, with 60% of our participants indicating suspicions of cerebral palsy or a like condition when their child was under 6 months of age. However, only 21% were provided that diagnosis of cerebral palsy within this time, and approximately 18% of families said that they experienced a delay of more than 12 months within this process. Further to this, 61% of participants also noted a delay between referrals to a service and the receipt of that service or therapy. Families were asked about their level of satisfaction with their diagnosis experience, with 51% of participants saying that they were satisfied or very satisfied, 18% were neutral, and 31% were dissatisfied or very dissatisfied. Common themes impacting on families' experiences in the diagnosis and health service delivery journey related to information, communication, timing of diagnosis process, and the provision of ongoing support and navigation of healthcare. And we were also able to link aspects of these themes with the family's satisfaction with the experience. So briefly, for example, health professionals that appeared to be open, honest, and very communicative throughout the diagnosis process were viewed more positively. Families receiving sufficient information during consultations about the diagnosis process and ongoing information about cerebral palsy itself were linked to positive experiences, as was an earlier identification of cerebral palsy or an ongoing at risk of cerebral palsy or under surveillance of cerebral palsy. So perceived delays in the receipt of diagnosis of the cerebral palsy process appears to be common. Families desired the diagnosis experience to be informative and timely, with early follow-up psychological support, an opportunity for questions and support in navigating the healthcare system. If you would like to read more, this paper has been published as an open access publication in the Journal of Clinical Medicine. We'd like to thank the families for their participation and the Starship Foundation for supporting this work. Thank you very much.